I'm Dr. Bill White, and we're going to try to show some cases showing the mechanics that we figured out in bringing impacted teeth into the mouth. In an earlier recording, we went through the mechanical device that we came up with, and it's very efficient in bringing teeth into the mouth. Now, on the first case that I want to show now, we show you how we came up with the idea. It was just a necessity to figure out how to get these teeth in, and we were having such a hard time that we came up with this idea of the springs and the dental floss, which we'll continue to show here. I'm going to go through this case now. Alright, the gentleman is a very nice fella, and he was a patient of my son's, and my son x-rayed him and saw these two upper impacted teeth, and the gentleman had just been through orthodontics, the whole orthodontic program with an orthodontist, and I'm not kicking the orthodontist on this, but the guy just didn't look at it. Apparently, if he saw them, he just didn't inform the man that he had two impacted cuspids up there and still had his baby cuspids in. And you can, if you look closely here, you can see these are deciduous cuspids that he's got in the mouth, and he has two impactions way up in this area. Maybe the guy just didn't want to mess with him. He got him looking pretty good, or maybe he didn't even see them. I don't know what exactly happened in this situation, but he brought this man over to me, and we x-rayed him and showed him the teeth, and he didn't seem upset at all that he had gone through orthodontics. They never even showed it to him. But here are the teeth. They look pretty good, except the color of the deciduous teeth is not good. But he's got him in a good class 1 relation, and he's really socked in very good. Take that back over here. This tooth needs to be rotated a little bit to fit in here, and this one wasn't all the way back in this area, but guys, that's pretty good. I don't know that I got it that good after bringing these cuspids in. We'll have to look at that later and see. And this was back in 1985, and I'm going to show the case I think about 10 years so later. When you look at it, you can see these two deciduous cuspids. They wouldn't fall out immediately, but the guy probably would lose them when he's about 40 or 50 years old, and then the permanent cuspids up there may form follicular cysts and things like that, which would be bad news. We had some spacing and problems like that in the case, but not basically it was just good class 1. Now this Panorex right here is not the best in the world, but you can make out the permanent cuspids right up in here. See, something like that, and there's one right over on this side going up and coming back down in here. And I'm going to erase that so you can see that a little better. The Panorex is kind of discolored and messed up there when I got the picture of it. But this was February the 28th of 85 when I took these records. Alright, we frequently would take the Panorex and draw on it what we were planning to do, so we were gonna come in here. On this x-ray you had some, in other words, this panorectomy is taken later on, and we had opened up the space in between the deciduous cuspid and the actually the lateral in this area. So we're going to try to bring that tooth down into this spot right here. So we had spring put on the arch wire. You can see the spring right in here, opening that space. So now we're going to have to try to slide that cuspid back here. Now, the cuspids are actually up in the palate. We'll show you that after I send them into a surgeon. And they were slightly ankylosed. They weren't really solidly ankylosed because we were able to bring them in the mouth. And the guy still has them, and they still are vital teeth. But we had opened this space in here, and looks like we put some force on the roots because they're still up in here rather than just pushing the crown over and leaving the root back here. We need to get this root over so we can bring this impacted tooth. You see, he's got to slide past this lateral and come to here. Now you don't want to hold this lateral tipped up against this real hard. You try to keep the root structure of the tooth away from the tooth you're bringing in, away from the crown right in here. So sometimes we would put tip on the arch wire, come down kind of like that, and make this tooth, make the root go in this direction, you see. After we pull the cuspid in. Okay, let's go now. Now this was 7/22 of 85. We had that space open, had everything bracketed and crowns on bands on these 6-year molars and everything. So after we opened this space and got it going good enough, we came in and extracted the deciduous cuspids and got them out of the way. Now in 9 of 86, in other words, we went from whatever, this was 85 when I had that, but it took us, I don't have the date on that, but it took quite a while to get these teeth in, and so now they're over here in place, and we'll pull them on down and have to rotate them to get them in place. Here, just showing on the clinical structure what we're doing here. We've got coil spring, open coil spring. It's condensed in this space, you see, and it's really putting pressure on this to open the space up. Same thing over on this side. We've got it packed in there as much as you could get, and we're just hooked onto that, pulling these teeth down into the mouth. So the teeth were extremely difficult, and they didn't move for a while, so I sent him into the oral surgeon, and he went up in there and just cracked them loose. They were ankylosed, just got them loosened up, and then we continued to pull on those teeth and bring them down. You either got to get them in the mouth or you have to get them out, one or the other. You don't want to leave them in there all your life. They can form that follicular cyst up there, and you don't want that to happen. So you're looking at it from this side, you can see that little spring. Now I tied a spring onto the tooth up in here and was pulling it toward the arch wire itself. But the only pressure is just on this little bitty spring coming through here, and you couldn't get a whole lot of force on that spring, and that's why we come up with this idea later. And here's the other side. See, the spring's tied onto the tooth. Now when he opens the mouth, we also had a rubber band attached to the hook. I've got the spring attached to the tooth and a rubber band attached to a hook that's on the tooth, and we're pulling this in the direction we want it to go, but the rubber band comes from here, comes all the way up and comes under and then comes like that. So when he opens his mouth wide, there's a good bit of force on there, but we just couldn't move the teeth with that. So we sent him in to get them luxated, and then we were able to gradually pull the teeth in. Now the rubber band, if you're going to use the rubber band, like we come under this little bracket and come up here, and so it'll pull the tooth in this direction, and we have a spring tied on here that goes back to the tooth. Now you can see it a lot better here, but if you didn't see that elastic, you wonder what the heck's going on here. This is with his mouth open pretty wide, and I took a mirror and put it in the mouth so it pushed the rubber bands back like that. Makes them look like they're pulling the teeth back in this direction. Actually, they're pulling them down like that. Now, all I could do is get this little bit of spring working in here, and this was a closed coil spring, and it had some effect, but I just wasn't able to move those teeth with it. Let's see, now the lower arch is pretty well lined up and everything looks good, so there's no big deal on it. We could do a little better cleaning job here. No problem there. If you look at the arch wire, we've got a kind of a molar offset in it. Right here where we form this omega, it's off to the side a little bit. And that, while we're here, we can talk about that. We need to line up these buccal cusp of these lower teeth, you see, so that's going to fit in the upper tooth's going to come up like such and come in, and so you've got these lined up, your buccal cusp over here, and we line this up right here real good, and so we have to bend this wire out a little bit to catch on the cuspid tooth so that the incisal edge of these teeth are pretty much in a line coming across here. That's just something I stick in here extra. Now, with a blown up shot showing this where we were and had to luxate these teeth. Now, when you send them in to oral surgeon, they just go ahead and they really uncover these things. Now, I've had some of them that would run up and come like that, or get it up close to the gingival tissue, and you have a defect in your gingival tissue there. But if you stay a couple of millimeters away from the tooth, something like this and this, then the gingival tissue right here stays and this fills in, and you can take off a big old piece of palatal tissue and it'll fill in. So watch this as we get through it. You'll see how this fills in as we finish this case up. Alright, the bottom is nothing special. And here again, we were working on this and we just weren't getting anywhere. And they were, of course, he's wearing elastic off of this too up here, trying to put extra force on them. So we had to have it luxated. Alright, we're going along and still we haven't got them in the mouth where I want them. So I thought, well, if I had more spring on the tooth, putting more pressure on with a spring, I could just take a solid closed coil spring and come off. And then I said, well, where I want it to go, I just made a loop in this arch wire big enough to accommodate the spring, you see, and ran the spring through there. You could set this up, then hook this, or poke the spring in here and hook it to the tooth and pull it through this loop and come back and tie it back in the back, you'd have a constant pull with quite a bit of spring force on that area. So that is a good idea, putting the loop where you want this to go. So we use that later. Now we could also pull with elastic, because I had hooks up there. But if you get somebody, send them to an oral surgeon, and they bond a little gold chain on there with these little loops in it like that, then you can't hook the elastic up to that unless you put some kind of hook on the chain, which makes it flimsy, and you can't already hook that up either. So I prefer putting your own hook on there if it's possible, and have it set like you want it before you go in there to bond it to the tooth. Now let's look at the bottom again. It's the same deal. So we're making some progress with this. Now this spring over on this side works good. It didn't snap in between here. And it might be if you had a little plastic sleeve on your spring, you would just go ahead and hook this spring over here and pull this through, and the elastic's pulling it in too and putting it into place also. Now this gap is plenty big for the tooth to come in there. Now over on this side, the spring's coming off of here, and as it turns this corner, it opens this gap in it, and it drops into this space. So now this spring isn't doing anything to help you, and it's just this little piece right in here that's trying to pull that tooth on into place. So we had to come up with something a little better to tie to the tooth and tie the spring so you wouldn't have that happen. Now if this took place all the time, you could do it that way, but it's a lot harder to rig the spring up there than it is to put this floss on it like we'll show you. Now, so I came up with the idea. I just looked over there, and there was some wax dental floss. I thought, well, heck, the wax dental floss will slide through that hole. So I opened a gap in the spring here to, shorten it to, and later where we could run the dental floss through the loop in the spring, and then run up in here and come out like this, and tie a knot in it, and that would be sufficient. Now the wax floss, as you pull it through a loop in the wire right like that, it'll just slide right through there with very little resistance, and you're pulling back with so many ounces of force. Then this worked quite good. And so that's where we came up with this idea. This is back in 11 of 86. So the latter part of 1986 is when we more or less figured this out, how we would do this. So it was a necessary thing, and so you figure out some way to get it done. And then I got looking around at the way other people bring them in, and I've not seen any method of bringing them in that's any better as good as this is, and it really works. And you can measure exactly how much force you got on if you want to, and you put it on there 1 week, and 3 or 4 weeks later it'll have the same thing, or 2 months later, or whatever. It'll be virtually the same. The spring won't just sit there and peter out over 2 or 3 weeks, or a couple of months, or 3 or 4 months as far as that goes. That spring will still be pulling, and the dental floss will be sliding through the little loop you've got in the arch wire. To bring that down, it'll have virtually the same effect on it. So this is a excellent way to bring in impactions. So here we're pulling it in, and then you've got to rotate them, and so we're pulling in a certain way. Now we pull it up here and get it in real close. Now you have to kind of hook what we've done in some cases, where we pull it as far as we can with this and put a kind of a piggyback arch wire on it. That'll help bring it down and rotate it too, and then continue pulling toward the lower arch with it. It's a lot of innovative ways of pulling that on in. So now we've got the tooth over to this point, and so we're pulling on the bracket over here. That's trying to rotate this tooth in this direction, you see. We put a bracket there, that's kind of rotating the tooth in that direction. And we've got plenty of room for them. We'll reduce that later on. So now we're pulling on the side of the tooth, trying to rotate it and pull it back. And the other side of the mouth is doing a very similar thing. Now you'll notice that we have come back here with a additional arch wire, usually a flexible wire that we hook or piggyback on top of the other one. And I've got an elastic chain coming up here hooked on this, and that's rotating this tooth in this direction. The bottom, I keep showing it, but anyway, we pulled it in, and the matter of rotating is just something. And we had a lot of space in here. We had an arch wire we were closing space with. Well, this arch wire, the omega back here at the back, got up against the molar tube, and so we had to shorten the arch wire. You want to shorten it the same on each side, or else you want to shorten it right out here in front. And it's shorter. Whatever you go up and whatever you go down, the arch wire becomes that much shorter. So you could figure on about twice that length that we shortened this arch wire on this side only. Now if you shorten it on one side and not the other side, then you're going to get the curvature. Your wire will be off. Your center will shift over in one direction. So you got a kind of a skewed arch then. So you want to do it the same on both sides, or do it in the center, which will keep it the same on both sides. And now as we put the arch wire back in with these little shortening loops, then this omega slides forward, and now we can tie that back, and it'll close the space in between the teeth. That's a trick maybe many of you will know how to do that, everything. So here we are with the elastic chain, see, pulling this tooth over, and we've got this dental floss that comes in. It hooks to the lower tooth down there, and it's pulling it in also and kind of rotating it. So now this will rotate around like that, and we'll have this pretty well finished. Now here are the cuspids in place. Now when we got them rotated good, we put new brackets on them and got it pulled into place real good. And you can look both at the lingual side. You can't see the tissue back here good, so we'll show that in another picture, I hope, in there. Now we pull the other one in, and we've got it occluded in a pretty good class 1 relation. And you pull these teeth in, and you remember we had a huge hole in this palatal tissue. We've got a little problem right in here, but not much. But I encourage you to go ahead. If you're uncovering them, uncover it where you can see it and get to it if you can. That's where the old surgeons do. They don't mess with it. Don't try to get a little tiny hole in there and then go get a bracket on it. Just, go ahead and uncover it good, because that tissue will fill in the palate. Now on the buccal, that's not the case. Okay, let me go back here and get rid of that. Alright, the cuspid looks quite good at this point, and we're using some little wing brackets to help rotate it here. That'll line it up on that very good. Alright, this is 7 of 88, and we've had him out of these braces for some time now. Now this is, I forget, several months later, but look at the tissue, and look, you can kind of see where it was pulled up through the tissue, but this tissue is filled in the palate, and you hardly, after it's been done for a year or two, you can't tell that it was like it was to start with. Whether just cut a piece up in here, take it out about the size of a dime. It wasn't quite that big, but when I first saw it, oh my God, how are we going to get the tissue back in there? But it comes in real good, so you can go ahead, and of course the oral surgeon knew that when it started it. Just don't cut it. If you're doing it yourself, don't cut it into this tooth like that, or you'll have a little problem in there, or cut it, your hole coming up against another tooth. It doesn't attach back to the tooth as good as it should. Alright, so the bottom, he still needs to clean those up a little bit. Now when he bites together, they've got a pretty good class 1 relationship now. And here's the guys. This is after we finished, and this is several years. This is 19, I think that's 88. He's gotten gray-headed over this. Looks pretty bad. Well, I said 88, that's not. This is 1998, and we were finished the guy back in, he started 80, I think it was 85, 86, and 7 in there. And here he is 10 or 11 years later, and the teeth, you just wouldn't suspect that tooth having that problem. Now this cuspid, I never did get it torqued in properly, so it's kind of slipping out to the side, and he may, as he moves the lateral movement, it may drag on the other tooth and keep it out there, but I would rather have this tooth kind of tucked in that manner before I finish the case like this. Now you can see that cusp is not torqued properly. It's torqued pretty good, but this is over 10 years later, and the teeth are socked in quite good. Now this side looks better, and here it is, 4 of 98, and looking at it, you wouldn't suspect that anything went on here during these this finishing part of it. Okay, that finishes that particular case, and I'm going to pause here for a minute. I'll have to run this over and click on it apparently. Okay, we'll cover another case. This is a young lady that worked in the office a few years ago, and she had a impacted upper cuspid, if I remember correctly. And I'm gonna need to get this little felt pen going back again. Here we see her after we have gotten this in. We've been into treatment quite a while, but I'm going to cover these quicker. Now we've got a whole string of these cases, and we've got a deciduous cuspid tooth right in here, and we're going to need to get rid of it. And we've got this impacted cuspid, you see, up in there, and we're going to have to pull this tooth down into this section right there, and we need to put pressure on these, to go apart with them. And so here's the case when we start off. You can see the deciduous cuspid right there that we'll have to get rid of, and the other side looks fairly normal. So here's the deciduous tooth, and it's still in the mouth, and this is 10 of 04. That tooth is still there, so I'm gonna come in down on the bottom. Everything looks pretty good, but we have to band the bottom to get it lined up. So we're going to change the arch form up above. We expand it so you can see the deciduous cuspid over on this side. We've opened up this space with that spring, and the spring is on a flexible wire, and you can put spring on flexible wire if you don't have too big a deal. Like if you were going to separate something had a spring like that, this wire would just kind of bulge out. It wouldn't have much effect. But on a short distance, you can put open coil spring on a very flexible wire. This had to be Wildcat. You could do it on a night tie also if you wanted to. Okay, this run through these pretty fast. Now we're expanding the arch and we're working with it. This is a kind of a distorted picture. The mirror will fool you sometimes. You stick it in like that and it makes this look distorted. It's not, really isn't distorted. You'll have to see it on another picture. Alright, down on the bottom, it's got arch form. It's not too good. We need to bring all this out over there in addition to what we're doing on the impaction. So this is a pretty good example of the arch wire that you make this loop where you want the spring the tooth to go, and you come over here, and this is a coil spring, an open coil spring. It's wound on. It just wind right on through this loop and come over here. So it's one single spring, and you can screw more of it out on this side, less over here, and you can change the position of where you're going to pull this by doing that. Now this other part in there is where we've hooked the dental floss coming in through here. Now the tooth is up in here somewhere, and this is our twisted loop. We've got it. We've already pulled it down to there. Now you'll have to cut this off and bend this hook back up further, and then pull it on down to where that comes in contact too. So I hope everybody didn't confuse you right here, but this is a wire hook, that 014 soft stainless steel wire. We make these hooks like that. Now this hook was probably up in here, and we pulled it to where it's running into this. It won't go any further, even though we have a lot of force on the spring over here. So we're going to clip that hook and bend it up further, and that'll bring it back. Maybe we'll show some of that later. So this is a little clearer picture of it, and you can see where we've pulled the hook down till it bumps the circle that we've got in this arch wire, and that's as far as it's going to go. When that hook hits that, then the spring just pulling against that. So we got some other problems in here. This is a little deficient lateral. You see, it really needs to be spread out some space up there and come back and put some composite or facing or something like that on that lateral. Now, alright, we've got the tooth in the mouth now, and so you bracket it where you want it, and you can rotate it. The tooth really needs a little rotation in this direction. It needs to come around like that. This lateral needs to be rotated too. Hopefully we do that. Let me go back on that now. And all right. It looks like we've rotated the cuspid fairly good at that point. We've got it in the mouth. It's got a proper tip. Oh, you see that? It's a good example of tip in the cuspid, a bracket. You see it's lined up like that. So it's doing pretty good. Now we've got to close the space up. Now the tissue around the gingival part of it is still good on it. Everything's lined up. Okay, we got that latest tooth in the mouth, and this is another case now that I want to try to cover. And this is a man in here that's about 40-something years old, and the bone is just extremely hard, and so it's a example of a real tough one to get this in. And here he's had almost exactly the same tooth as that young lady did. See, this is a deciduous cuspid right there, and his bone was really hard. I mean, there's much difference in people. I mean, when somebody gives you a deal, says you put so much on it here, and then you go for a week or two, and you put a little bit more, and then a little bit of this, and that this is going to move it. Well, this is just a bunch of bull, you know. We did the same thing on this guy we did on the other, and it didn't move one bit, you know. And so we had to come in here and just really get with it to get this tooth to start moving. So this is a perfect example of showing you the difference in people's bone structures. When somebody tells you put so much and this is going to happen, and so much and this is going to happen, that is just not the way it is. You have to put enough, you have to change. Some people, you just put a tremendous amount of force on them and their teeth don't even get sore, you know. And other people, you just put a light force and their teeth will be sore. You don't want them real sore. You just want them a little, as they tap their teeth together, they can sure feel that something is going on in there. So here we go on this fella. Same thing, the upper left, this is a cuspid very similar to the one we just pulled in on that young lady. So we've extracted the tooth. We've come in here with a big daddy arch wire to spread the arch out. These teeth were all tucked in, so we put this big arch wire on there, and I couldn't get this tooth to move at all with just one spring, so we put 2 springs on the thing. And I put about as much force as I could get, so we'd run them out, and that'd be about a pound on, or 16 ounces on each of these springs. So we got about 2 pounds pulling with the spring itself, and that pulled the arch wire in, so I had to put a big daddy arch wire going around to the other side. So for it to pull the big daddy, it had to push the right side of the mouth out. So you're pitting all these teeth on the other side of the mouth against that tooth, you see, to bring it down in here. This is an interesting case. I've never had one quite so hard bone as this one to get it moving. But finally, once it got moving, then we were able to do it. Now we've got this new idea that's coming out now, where you just go in the area you want the bone to move, and you just punch a bunch of little holes in the bone structure, and it causes this reaction where the cells, or the osteoblasts and osteoclasts, really get into the action there. And so that's going to be a coming thing, which is a good idea. Now, I don't like this fast braces method where people come in and they strip the tissue off and go in here and cut the bone structure down in here. It makes the teeth move fast, but God knows I wouldn't want anybody doing that to me. So anyway, I don't like this method of cutting in around the bone, but I do think this little bone drilling little tiny holes in there is a good thing. Just something that stirs up the bone structure and starts this healing, and the teeth move faster and during that time. So I'm all for that. Now this is coming along, and you can see we not only were pulling it with the springs, and each of these springs got about a pound of force on it. Now this little hook we put on the tooth is made out of that 014 soft stainless steel wire twisted down, and now we've come in here and hooked an elastic to the hook too. So these little wire hooks that you make, they'll take probably about 4 or 5 pounds of force before they would just straighten the hook out and bend it out. So they're twisted, and you make them fit, and you have them exactly where you want them before you bond the bracket or the button or whatever you hook them onto. You bond to the tooth with, have it going like you want it before you stick it in the mouth like that, and then you don't have to reach in there and try to bend it with a pair of pliers and pop it loose, you see. So here we've got the little circle in the arch wire, see it coming right here and coming, and then we're supporting this wire with this big daddy. We come over there and tie it to that. So if it pulls this big wire down, I had so much force that it was taking this regular arch wire, dipping it down like that. So now I've got it tied to this big daddy arch, and it'd have to push the teeth out on the other side of the mouth. So we finally overpowered that tooth and got it moving. Now here's the way it's hooked up. Now when you have this type of hook, the patient can hook this one. I mean, he reaches back here, or he just hooks this one, goes over and catches there, and then brings this one down, something like that, and hooks it under there, and that makes the tooth go in that direction. And it's coming out here with these too. So this is loading one up. I mean, it's got over 2 pounds of force on that tooth, bringing it in the mouth. So I hear people, well, you know, we just use so many ounces and all this, and we do everything. I wasn't having any result with it. I either thought the tooth was ankylosed, I was going to have to send him in, have it popped loose, or put enough force on it. If it was ankylosed, we broke it loose with the force, moving it out. So you can watch the tooth now as it comes on out in the mouth. And that's a double spring, pulling it in like that. Now here's the elastic. You see the chain coming up here, and you hook the elastic on it too. But this is bonded to a bracket that's put on the tooth right in here, and we're pulling this thing right toward that place. Now there'll be some friction on the floss going through there, but very little really. So if you're pulling with 2 pounds of force out here, that's not very good too. Say 2 pounds of force, then you may have a friction in there that take away an ounce or two, but there's very little friction as this floss slides over this arch wire, the loop you've got in the arch wire there. So now we've got it up close, and when we get this in, we continue to pull it there, and this is pulling the root. You see the root's back in here, so it's got to kind of come around that way. So we'll be pivoting it off of this tooth and put it off of that one too. So we'll pull it over and get it up in here, and these roots going to swing around. Then we put the right torque and tip and all that on it after we get it in the mouth. Now here it is in the mouth, and you can see the tooth is still vital and everything. And this was back in, that's 1990, I think, and he was age 41 and 7 months when we started this. We're going to extract that and pull this tooth over in there and then bring this root kind of line up with that tooth. So that's March of 90. Let's see, And that's 11 of 90, and we hadn't gone very far. I mean, it was, so I thought we have to go in and luxate that cuspid, and I didn't want to do that because it's right up there on the root of that lateral. It's superimposed over it, so we don't want to mess up the lateral, so we didn't. So here it is, 10 of 91 before we actually get that tooth into place. And it's finally there. And now here he is several years later. This is 96. Let's see, this was 91. And the time before that's 90. Okay, 90, that's when it started. And we had it out pretty good, but by 96, we had a 3-3 on him, had him taken out of it, and the tooth is in the mouth, and we'll look at it from the outside. So here is this tooth. We've expanded the space and put it in place, and the color of it shows it's still vital, and we pulled on that tooth with at least 2.5 pounds of force to bring it in. And it moved over in there, and that's 98 or something, 96, and there the tooth is in place. So here it was in 80 something, and there's 96. The same tooth, and the same mouth, everything several years later. So that, as far as difficult, hard cases, that was a tough one, and you won't want to run on to one much tougher than that. If it doesn't move with that, you send the case in to get it luxated. Now, I think we've got another case coming up here. This is I think this young lady's from India. I'm not certain on that right now, but she had an impacted tooth, very similar to that. Or maybe she's from Hispanic, and okay, when you look in the mouth, you can see the lateral is out of position on the left side of the mouth. Seems like these are all left, upper left cuspids that are impacted here. So there's no deciduous tooth in there, so we're going to have to expand that, and we've got a tooth up inside this. So let's run through this one pretty quick. It's slightly class 2, so we'll have to get everything lined up, correct the class 2 problem at the same time. So the bottom arch is crowded. There's some shape of the bicuspid that's a little extra wide, so we'll see if we have to expand all of that out. And I think we were kind of protrusive to start with, and we decided this would work out better if we took some teeth out. Now, some of you will like that, some of you won't like it, but look at her profile here, and that's just a little full to me, and it's also got a little extra vertical height of the lower third of the face, and it's a little more than the other thirds of the face, and so I'm going to recommend extracting some teeth on this particular case, and probably she's got wisdom teeth. We'll have to go in and see what's there. So we line everything up and had a kind of a closed bite, so we've got these intruding arches, which we have a deal on intruding arches. These arches come out like this up above, and you put them on, piggyback them over a flexible wire, which is rotating all the teeth and all the good stuff that the flexible wire will do, and this opens the bite at the same time. And we get the space in there, we'll pull these teeth down into place. And so we'll start opening the gap. Now, where we extract teeth in there, we won't have to do all that much opening in the case. So by doing this and going fairly slow, we don't open the vertical anymore, and we probably will get it to close down to some extent. So I'm going to run through these. Here's the cuspid coming in from, no, this is not the tooth, this is the glove right there, so the tooth's a lot further up. Now, same thing down here, we'll slide the cuspids back. So let's go on right quick, and but I'm going to show all the slides. Now, we've gone in and uncovered this and bonded a little lingual button on this tooth. And we had a pretty good size hole here, and it's already filled in a good bit. We bonded this and have this. This is an 014 soft stainless steel wire, twisted up, and we put the hook up here, so we're pulling in that direction with that hook like it is. And now we're pulling the cuspids back with elastic chain, and if you want to rotate them, see, this one needs to be rotated maybe a little bit like this, so it put more pressure over here, and as it comes back, the tooth will, you can end up rotating it as you back it up, and then we'll bring these teeth out into that space. So you get a little distortion by that mirror pushing back in there. Alright, this is looking up from the bottom, which is a pretty good view to look in there. And you can see the lower teeth where they contact the upper teeth like that, pretty good. So we've still got our intruding wire on the upper, we've taken it out. I mean, the intruding wire's on the lower, and we took the intruding wire off the upper right here. Now we're moving the lower cuspids back, so you can get an idea. We're dragging this wire through here, and it just, the tissue will just lap over it, but that won't hurt. You can pull this on up in here, and this digital tissue will have filled in that whole gap that you cut in there to bond it. I didn't have a real close picture of that. So we got that lady's tooth in. I don't have any other photographs on it at this point, but anyway, I'm going to go in here and show you some of this where we put a palatal separator and kind of expanded it. So this is a totally different case. So we've been going about 53 minutes. I'm going to stop this right now, and okay, we're recording again, and we're going to go into a couple other cases here before we kind of relax on this. This young man here has let me get him going again. Has a couple of one of his cuspids is pretty badly impacted, and the other one is just moderately impacted, which should come in without too much of a fight. The slides we took on him didn't turn out too hot, but you can see what I'm talking about here on this guy, and we'll run on till we get to the pictures of the teeth. The lower arch had a couple of deciduous teeth that are just being kind of rooted out by the permanent tooth, and sometimes that cusp of the permanent tooth will be up inside that. It takes a lot to get this little deciduous tooth off of that permanent tooth to get it in place, but it can be done. It's not too big of a problem. So here is the first Panorex that we see, and there's a lot of things here that we should look into. One of them, I want you to notice how the deciduous molars are just hollowed out and you just have a shell of a crown, and these little cells that eat away the dental structure on the tooth just eat it out. Just a little crown shell is left in the mouth, and that's kind of illustrated on both these teeth right here. Now the cuspid tooth that is impacted here is laying over this lateral tooth, and when you look at it, you can't tell whether it's labial or lingual, or but you get a pretty good idea by palpating and seeing where the tooth, the bulge in the mouth is. So I'm pretty sure this is a lingually located, but it looks like the tooth has been resorbed a lot. But after taking the Panorex and probing up in there, you find that it hadn't really resorbed all that much, and you can see it come on down. Now this tooth is just in the clear, and we'll show that it takes longer to bring this one in than it does to bring this other one. So they're going to make so much noise coming down like that. Let's see. It looks as if part of this root is just eaten away by that crown of the deciduous tooth, but I don't think it had any bad trauma from it. I think the tooth survived and lived through it all right. Now when we come in to look at the space where we've got to put the teeth, I had Dr. Graham working with me at the time, and he knew Dr. Burstone, and so Dr. Burstone had a little expanding accordion type spring that he put on teeth to expand them, and this little spring has a great deal of merit, and I wanted to show it to you and show you why that it is so good. Now in both of these brackets we have a vertical slot coming down like that, and so we can shove wires up in between that spot without any trouble at all. Now I'm going to go back over here and just get a white page and show you how that little accordion spring works. You know, you come up, you got one leg that goes up in the deal, and you now you can slip this on, and it goes through the little vertical slots of the tooth. And I think our TV guy's come here, and got to go see what he's doing, so I'm going to pause again and stop. I'll have to get my arrow over there. Alright, this is a neat little spring for expanding teeth, and the reason is you drop these little deals in the vertical slots of your brackets. So if you got a bracket on this tooth, this is small bracket on there, and you run that up in the vertical slot and kind of bend it over like that, and you can activate this down here at this corner, and it's bended, and it makes this angle out like that. And you can do the same thing, it'll cause this one to angle out too. And then you expand the spring and pull it together and put this up in the little slots, and the spring is pushing the teeth apart, and at the same time it's pushing the roots apart. Now this was a nice idea that came from a Dr. Burstone. So if you had you can have more than loops like that. You can have several loops in it. And say these you would run up in the vertical slots of the tooth. Now, this would tend to tip the roots out too, up here, the way this is angled, tip the roots out. Then if you come in and expand, well, if you expand here, it'll tend to lay that out, and that tips the root out. And if you just stretch the whole spring out, make it longer, these get a bigger gap in between them. You squeeze them together, put in there, so it's putting force on the teeth right at the crown, whereas this will put force on the roots of the teeth to bring them out. So if you got a, say, a cuspid tooth in here, and you've got a lateral, well, whatever, if you have a tooth right in this area, and you've got the two little brackets on them that have to be angled up something, that this is a quick time drawing, and you've got this vertical slot in each of those. Now you'd run the spring up in there and bend these over. Then you can activate this vertical deal however you want to. Press it here and make this arm lay out like that, and then you can make the arm where it wants to go out here, but you use most of the energy in changing the position of that tooth in there. That's a very useful little spring, so I hope that many of you pick it up. Now you see this spring is angled right here, and he ran it up in there, and over on this side it's angled right here. So as he's pushing apart with the spring, the roots are going apart even more so. So the roots will be going apart, and the crowns are going apart at the same time. So that's a good little spring to learn how to use. Now, this is the upper, and there's upper cuspids are impacted in this area. And so down on the bottom we've got some spacing of the teeth, and we'll want to close that up and end up with the teeth looking real nice if possible. So here we're taking the roots of this lateral and moving them forward. They're moving in this direction. You can see how you tend to move it. And these, you see the tooth going down like that and up. Okay, that's a nice little spring to learn how to use, and let's hope many of you get to use that. Alright, here we're going to be attacking this as if we've got a lot of rooms in the arch, you know. We didn't have that much room, so we took a plier and really flattened the contact points with it. Alright, here is the panrex of this case, and you can see why the tooth we're trying to bring in, you don't even see it up in there. You're just looking at some blades of drac right there to bring this tooth down in this position. Okay, now me. Hello, Martin. Yes. Have you heard from Al or anybody?
Well, I talked to Al this morning. I saw him at breakfast. He said he was bored. He was going back to Dallas.
Oh, really? Doesn't take
Yeah,
more.
he said, "What anything to do down there?" He said, so he's going on. So I told him I was going to call you and see if you might want to go get a burger tonight.
Well, Winnie had just suggested a while ago, said if we don't hear anything, well, we just call Martin and see if we can go get a burger, or anybody else wants to join us. I don't know.
Well, I
That
think old Johnny Matthews might. Sure, I think is sick, but I talked to Johnny. He's on his way up from South Texas, and
well,
he said he thought he'd be here in enough time to meet us at 7 at the burger place.
that'll be fine. We'll just do that, by George.
Well,
I don't know.
I'll just see you there at 7 o'clock.
We're gonna have to give Al a no boring pill.
We're going to have to find something good for him to do. You know, he's knocked down all the trees that he knocked down without making the place look like a war zone. You know?
Tell him we can't afford a helicopter to let him fly around over there, but we could get him a toy one of these. We could get him one of these satellite things that flies around, comes down, and settles on top of people.
Somebody emailed me a video. I think it was my daughter. Anyway, this guy was herding cattle with a little
Oh,
control car.
oh,
And it was the funniest thing you've ever seen in your life. The cattle would run from it, but then if he turned around and ran the other direction, the cattle would chase it. And they chased it. He ran those cattle all over the pasture with that little car. I thought I need to get one of those to see if what the goats will do, you know?
that might be good. These little drones they've got now, all kinds of drones. They said they're going to start delivering packages with a drone. Fly it out and set it on your front doorstep or something like that. Now you might could chase cows around with those. That might be pretty good.
Wouldn't that be fun? That does sound like a lot of fun, doesn't it?
They wouldn't be running over you. You could just have them chase up
This one little old yearling calf just thought that was the neatest thing he ever seen. Boy, that little car take off, that calf just get right in behind it running for it. You know?
I'd like to see that.
I gotta find that. If I find it, I'll send it to you.
All right. That'd be
All
pretty
right,
neat.
I'll see you then about 7 o'clock tonight.
About 7 o'clock. We'll be there at the Green Pickle. I guess that's where you're talking about.
Oh, absolutely.
Yeah. All right. We'll see you there. Thanks for calling.
You bet.
Bye-bye. Gosh.